Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pterygium. Pterygium is actually a degenerative and hyperplastic condition of conjunctiva is called as pterygium. In the pterygium, the subconjunctival tissue undergoes elastotic degeneration and it will proliferate as a vascular tissue. The subconjunctival tissue undergoes elastotic degeneration. There is degeneration occurs and this will also proliferate as a vascular tissue. Okay, in the pterygium corneal in the cornea the cornea has actually the five layers. First we have epithelium of the cornea, then we have the Bowman's layer is present, then we have the stroma, then we have Descemet's membrane, and finally we have endothelium yet again. So among these actually corneal epithelium, okay, Bowman's layer and the stroma is destroyed in pterygium. So in pterygium, corneal epithelium, Bowman's membrane and stroma is destroyed. So pterygium mainly occurs due to the ultraviolet rays, dry heat and dusty environment is associated with pterygium. In pterygium, actually, if you see that this is the pterygium, where you see that this is a triangular fold and this triangular fold is encroaching over the cornea. The triangular fold is encroaching over the cornea in the palpebral area of the aperture in the nasal side. So usually on the nasal side, a triangular fold is encroaching over the cornea in the palpebral aperture, usually over the nasal side. So this is called as pterygium. So this pterygium in most of the cases is asymptomatic, and it only the problem here is cosmetic intolerance is the only problem here. Visual disturbance can occur because of the whenever the encroachment of the pterygium goes into the pupil, that is when the patient will develop corneal astigmatism. That means if this is the eye and this is the cornea and pupil. Now if there is a pterygium and it is going through the pupillary margin, that is when the visual disturbance is seen. So diplopia can occur in some conditions. So in some cases diplopia can be seen, and this diplopia is mainly because of the ocular movement limitation will result in diplopia. Then now treatment of the pterygium. Pterygium actually asymptomatic pterygium is left alone. There is no problem. You can just leave the pterygium as it is. But surgery is the actually for effective treatment. Surgery is the most effective treatment which can be done for pterygium. You can either do simple excision technique can be done or bare sclera technique can be done, but it has almost 80% recurrence rate. So better approach is actually conjunctival autografting can be done for treatment of this pterygium, which has a better approach. Then in the pterygium, there is iron deposition occurs in the epithelium of the cornea in pterygium, which is called as Stocker's lines. So in Stocker's line is iron deposition of in the epithelium of the cornea is called Stocker's line. So this is the Stocker's line which is seen here.
thank you for watching.